All right, good morning guys, and welcome back here to the Huntline. I wanted to go through a case with you guys this week that we've been doing a lot here over the last couple of years. It's something we've talked about, our roundhouse technique, but I wanted to go through it in a little bit more of a detailed way so we could understand it a little bit better together. This patient presented to us with obviously multiple missing teeth here in the upper area. And really his main complaint was that he wanted these teeth back, and we had some other issues with some of these other teeth, and as far as gum disease and whatnot goes, and certainly missing the lower molars on the bottom as well. So we made him a plan to ultimately replace his upper teeth with an implant prosthetic, which is the roundhouse, and we gave him single implants on the bottom. We'll kind of click through that and show you what it looks like. So again, this is how we presented. And we can see we've got a low lip line at rest here. Smiling, we're just coming across the crest of the gum. And the ridge lap of the roundhouse, because it's built as Pontics, the ridge lap will come up and lap over that, making this emerge right at his lip line. So we'll go up through here. The day of surgery, you can see we've got our single implants placed in the molar sites on the bottom. And I went ahead and put in mini implants. This patient had excellent bone in the anterior maxilla. And we did some little vertical sinus tinting. I went ahead and buried molar sites for conventional implants. And the long-term plan is to restore this as a detachable roundhouse prosthetic, okay? Clicking up through here. Transfer copings when we go to take the impressions. Few months later, and here's the final crown on the x-ray the day that we put the lower crowns in on the bottom. As we get to his final, you can see how nicely this fits the tissue. This is one of the things I'm most proud of on this case, is that we've really got a nice fit to the tissue, a good seal. We're not getting food debris under this bridge. This roundhouse does not have flanges on it, and it's much smaller than a denture. It's going to feel more like natural teeth. Now it's bigger than natural teeth, because we need enough thickness of material to hide all of our attachments, but it is much closer to feeling like natural teeth. I want to show you guys here, when we originally did this case, let's see if this camera can pick this up, we had to add composite to the bite. So when this patient bit down initially, when they bit down, only the front teeth were touching and the back teeth had air between them. And that's probably because the day that I picked up the implants, when I put in the implants and I'm immediately retrofitting this pre-made roundhouse, the day that I picked up the implants, I probably had one of the implants binding, and that was causing the entire bridge to shift just a little bit, making the bite open in the back. So what we did is we just simply took very quickly and we added some composite. This is the larger diameter composite that you kind of buy in a log. I call it log composite. And we added it to the occlusion in the premolar areas on each side where we had our mini implants. And we gave him bilateral contact. As he bit down into that, then we cured it in place, trimmed it up a little bit, and he wore this during the 6-month healing phase. So if you ever have a patient that you're retrofitting a full arch appliance, whether it's a denture, a roundhouse, or whatever, and the bite is off a little bit, things are going to heal and change. So sometimes you can just do a little bit of very quick equilibration with some composite to give that patient really nice even bilateral contact. They're going to heal better through the healing phase. They're going to feel much better with their chewing ability and their jaw position, and they're going to feel like you really nailed the case, even though the bite was a little bit off, whether it was because we were retrofitting to the implants inaccurately or whether because the initial bite was taking in a little bit of the wrong position and it wasn't in CR. Hope this helps. This was a really nice case. Roundhouse prosthetic, PMMA. He'll look to go to zirconia finals here in a few years when he can get a little bit more money together. This is a prosthetic we've been doing for a while now, so we've enjoyed it, and we're always all about innovating it along the way, always trying to make everything better every day. Check back next time.